Welcome to the latest episode of CarePoints. I'm your host, Kenny Schiff, Director of Marketing at Lone Star Communications' new Alero business unit. Today's episode is part of my continuing series of conversations with collaborators at Lone Star, customers, partners, and notable folks in the tech and nursing industry. It is my pleasure to interview Patti Artley, the Chief Clinical Officer and Chief Nursing Officer for Medical Solutions, a hospital-specific staffing consultancy, and Amy Ricords, Vice President, Customer Relationship at Peak Outcomes. Welcome, Patti and Amy.
Thank you for having us.
Yeah, thanks, Kenny.
I have a good friend who some of you know, Bill Sterling, and he suggested that I do an episode about technology adoption in hospitals that was not about the technology itself, but all the other things around it. And reason I was interested in Patti and Amy, they have extensive boots on the ground clinical background, and they've done a lot of work providing services to health systems across the United States. So the theme that I'd like to explore is, why aren't hospitals getting the level of impact and payback that they've expected by the technology that they purchased? When we first met to plan the podcast, we talked about how these new shiny objects keep coming along, and yet customers kind of keep having the same outcomes. So today we're going to explore a bunch of that. So I'm going to start by asking my guests to introduce themselves and tell us a little bit about their current roles. And then we'll put a link to their LinkedIn profiles and a more detailed bio in the show notes. So first, let me start with Patti. So Patti, tell us a little bit about yourself and what you do today.
Hi, well, Kenny, I am the Chief Nurse, Chief Clinical Officer of Medical Solutions. And for that, I work with a lot of our partners in the industry and in the hospital setting to help supply them with staffing. But also my role is really to help make sure that they're optimizing their workforce. And that comes with some consultative services and some really reviewing what they're doing and complementing that. Prior to that, I was the chief nurse at a health system in South Carolina and health leader roles in Pennsylvania.
All right. Thank you. Let's go to Amy. Amy, tell us about what you do today.
Sure. It's always an interesting conversation when I try to explain it to family and friends. But my current role is I work with our clinical informatics team. We are considered the translators. So when we go into an organization and we're looking at the technology that they have and how we can save steps, be efficient, improve patient outcomes by making the technology work for the people who are delivering the care rather than in its silo. So we're communication and healthcare integrators. And as you said, extensive clinical background, been a nurse for about 30 years and worked in everything from quality to informatics and education.
Great. Thank you. So we're going to do a little bit of back and forth between Patti and Amy, and I'm going to start with Patti. And this first section is about assessing adoptions and implementation. So Patti, what departments within the hospital have the highest and lowest rates of technology success, and why do you think that's the case?
Well, Kenny, I don't think we can really say acute care adopts better than ICU or ICU adopts better than the emergency department, because I think it really stems back to what we're trying to accomplish. And those that engage the frontline team in what the problem is they're trying to solve, I see, regardless of their place in the organization, they're the most successful. I'd say layering on their frontline leaders, having the capability and the skill set to really understand how to make change happen and to hold people accountable for it, actually make a much better opportunity in changing the process and adopting the technology than any one individual area in the hospital.
All right, great. Amy, you want to piggyback on that a little bit? What's been your experience?
Yeah, I think Patti's hit the nail on the head with that. Having the right people at the table to make the right decisions at the right time is absolutely key in any implementation, especially a technology implementation. And we've found that organizations across the country. Everybody does it a little bit differently. But those folks, as Patti said, at the front line who are helping you make decisions, but then you also have senior leadership support who are helping to kind of herd the cats and make sure that there are global decisions that are being made and we're not making decisions in silos is absolutely important, because the ED will always think about the ED first and not what the ICU needs. And it doesn't matter what that setting is. So it is really important that you also have that senior leadership that is helping to ensure that the decisions that are made are good for the entire organization.
Which dovetails into my next question, which will be for you, Amy. So are hospitals doing a good job planning and for deploying technology and then deploying it? And are there ongoing training programs typically to keep staff updated on new features and functions? And, what's working in that regard and what's not?
Yeah, that's a loaded question. Hospitals doing a good job. Having been on the hospital side and being that person who was in charge of making sure that the implementation went well, I can tell you all of the mistakes I made along the way, which is really has poised me for the position I'm in now to help warn organizations as to what not to do. But I think that, it comes down to one, understanding what it is that you are trying to implement. So what I have found is that a lot of organizations have a different set of folks who make the purchase, and then there's a different set of folks who use the purchase. And because they're not talking to one another and they're not intermingling, we definitely see that there's a miss in, oh, I didn't know we bought that, or why did we buy that, or we don't need that, or that's not until phase 3. No, now we need this, and there's just a lot of red tape that comes along with then trying to get an organization who has made a purchase that's going to be meaningful and impact the metrics that we're looking to impact. So I think that when we ask that big question, are they good at it? They're getting better, but it really does come down to communication and getting the right people at the table to make those right decisions. And then it comes down to, I feel like it's my responsibility now on this vendor side to really show that this is a partnership. And when you buy software, you're not buying a short-term relationship. You're buying a long-term relationship, and it needs to grow with you. We're not building a house and walking away. That we really have to set up what is that cadence and governance structure going to be to help ensure that what you've purchased is going to change with you and be fluid and dynamic for you, which then plays into the second part of the question, which was around education. So yes, ongoing sustainable education is so important with the turnover that we're experiencing in healthcare, just along with the fact that it's not the new and shiny thing any longer, and I've moved on. We need to ensure that the vendor partners are part of that ongoing sustainable education, so we can ensure that the technology is continuing to be used in an important way.
Great. So, Patti, I'm going to go to you. We're kind of exploring a related area here. So, what are the challenges during the implementation of new technologies? And since you're really in the people business, I think there's a lot of people stuff to be talked about. And if so, how are they addressed? How should they be addressed? What are the challenges and opportunities there?
Yeah, well, we've started to hit on some of these in the first two questions, but we'll take a little bit of time to elaborate a little bit more on them. When you really think about the frontline staff really driving what you need to address, we've referenced that shiny object. We all know we've gone to conferences, we've seen something, and we think this is the thing to implement. But really, those organizations that are most successful have engaged the frontline team who bring the solution or the recommendation forward. I have seen that's where the engagement really is taking place. And those organizations that take the time to really investigate what's the real issue I'm trying to solve, and then do their due diligence on searching those technologies that are out there rather than just what's the first one that hits their door, I think are really successful. When we customize technology a lot, I've seen that really go to our detriment. And I've been a part of many of those where I was the leader who thought that was the best technology because it allowed us to customize the most. But that's a fine line and a real balancing act, because you have to make sure that what you're designing isn't breaking the efficiencies of what the technology was set up to do. And that's one of the big areas that I think organizations have an opportunity for. And like I said, I've led those and I have been a part of those. And when you do the after action and you look at why we're not gaining the kind of efficiencies that we should, that's usually where we're missing the mark. The other thing I'd say is when you don't invest in the upfront. I had a mentor of mine who used to say that the majority of your time, 60% or more, should be spent on that, assessing what you're trying to solve, looking at the technology, and in that implementation and that planning phase before you then take another 10 to 20% on implementation, so that when you are looking at the back end, you have no more than 20% of the time investing in that. And it's those organizations that really spend that time up front in the planning and making sure they're setting it up appropriately are always the ones that I see as better adoption. And they're also the ones that when they take the cadence and on that back end, everybody understands their role of accountability and they've done a good job at setting up metrics for success and teaching the frontline leaders how to drive accountability and make sure that it doesn't become that flavor of the month, really helps with not only the engagement, but the satisfaction in and adoption of the tool.
Great, which is going to lead me well into the next question. So you mentioned accountability. So this is for you, Amy, and then we're going to kind of start with just looking at the measure of the success of the technology from an implementation standpoint, and then we're going to go deeper into the whole data thing after that. So, Amy, are hospitals adequately measuring the success of technology implementations? And are there any key metrics that could be tracked that are not?
I wish I could say that we were doing this well. I think that so many times, by the time an implementation or we're digging into a technology project, we're already behind the eight ball. We know that our timeline's pressed, and we don't have the resources to make all the magic happen. Therefore, time is not put into what are the metrics that we should be capturing pre-implementation that we want to be measuring post-implementation. And a result of that, then you implement your technology and all of a sudden we don't know if we're actually making a difference. That ROI that we talked about in the sales process, and everybody gets excited about, and then suddenly there's kind of this letdown of, well, did we really do what we said that we were going to do? I think there is to speak a little bit to what Patti was just speaking to. There is rarely a technology that's going to be a silver bullet, and the only technology I can say that's ever done that for me was my rice cooker. So other than that, there's not a whole lot out there that is going to really solve your all of your problems. But if you, again, have that kind of trusted partner and relationship with the technology experts, and the folks are on the side of the manufacturers and the of the technology, they are the experts. So being able to say, this might not be the best answer for you. This particular feature might not be the best feature for you. Maybe you want to use the feature that you have in your EMR or this system because that's where the workflow is. These are some of the conversations that we need to be having if we are going to really see results in some of these hard to crack metrics that, again, we're not doing a great job at sharing from the beginning, but I think that it's part of the whole package of really making a difference.
So I'm going to ask you both, and we'll start with Amy we're going to dig a little bit into the whole data analytics thing. So we're talking about measurement first from a technology success factor, but these technologies, all of them, are connected technologies. Inherently, they're producing enormous amounts of data that tell us a lot about user behavior, patients, populations, just any combination of those things. So the question for you, Amy, are hospitals effectively using data analytics tools, especially integrated with EHR, EMR systems, and related workflow platforms? And if so, how are they improving patient outcomes or hospital operations with that data?
I think we really struggle with this area is one that not everything is an analytics. Sometimes it's just data display. And it takes the clinician to analyze what it is that they're seeing and put it together. But unfortunately, what I'm seeing are again, these silos. Where the systems aren't talking to one another. Therefore, I'm gathering information out of system A, B, C, D in order to analyze it. And then if I do have an analytics tool that's going to work that magic, I have to go to a completely different platform in order to use that. It's not within a tool that I use from a day-to-day, just from day to day. So there's so much data in healthcare where we are not, in my opinion, using it in the best way, and it's really because of that siloed approach in which it's being presented to the people.
Yeah, let's have Patti follow on that. So Amy talking about data, but she's talking about silos, and there's people silos and there's data silos. So you talk to a lot of different. The great thing about you is you know your company is national. You interact with people all over the place, community hospitals, major medical centers. So what's your perspective on the whole data thing? Have we just kind of scratched the surface, and what's it going to take to actually kind of get over the hump on that front?
Kenny, without a doubt, we have only scratched the surface. And I see hospitals that do this really much better than others, but I couldn't say any one of us would say we do it well. We still have a lot of disparate systems that don't speak to each other, as Amy just was alluding. And as long as we just layer on one thing after another without figuring out the integration strategy, that's where we miss the boat. And I think that the more we involve our health information systems technologists and our officers in this process from the beginning. So I have individual hospitals that have an entire team for deployment or implementation of projects. And that's really your project managers. Those are the individuals who are, from the IT perspective, the information systems perspective. They're the team that's looking at analytics. And when they're partnering with the frontline teams and the sponsor, that really keeps them all on the same page, they can design a system from beginning to the end that really helps leverage the technology and leverage some of that AI capability that might be there that you might not tap into if you're just digitizing the same system you've always used. So
yeah,
it's really coming.
Yeah, it's not magic, right? You don't just throw all this stuff into the pot, mix it up, and bang, it's a good tasting soup.
You bet.
So, Patti, we're going to shift a little bit, and the next question for you again about impacting utilization is: what are the biggest barriers to start fully utilizing the functionalities of new technologies? And how do we get over those?
Yeah, so I think the biggest barriers that I've seen is when the right people aren't at the table, or the engagement from the front line. We're trying to solve the wrong problem. Are some of the biggest challenges. And we've already talked about those, but the one that I don't think we've really spoken enough about is when we don't keep it simple. Amy touched on it a bit. When we design systems and processes that don't improve the workflow and don't enhance the way that a nurse or a tech work at the bedside, that's where we miss the mark. And when we layer on more for them to do, and that's the way that the care team member sees it, as one more thing for me to do, we have huge barriers in adoption of the technology. And I've seen that happen. I've watched it happen. The other part is really when we don't do a good job of engaging the front line at what we're trying to accomplish, so that they can help us get there. When we do it, it is an episodic part, that also is detrimental. One of the areas where I think we have opportunities for improvement is really leveraging that full team complement instead of doing things in silos.
I completely agree, Patti.
Yeah, go ahead, Amy.
I was agreeing with her. I said, there was a very smart leader that I worked with who constantly said, you have to make the right way the easy way, or it will not be embraced. And she was absolutely right.
So one of our last episodes was with John Elms and Brian McAlpine, both heavy-duty technologists and business people. One of the things that John mentioned in his in one of the questions I asked him is, he said, good enough from a technology standpoint can win out and will win out if all the other things are rounded. So your point about simplicity and having all the other things in place from a support. And the other thing that came up as I was listening to you both was two things. One is, it's not getting people involved in the process, it's getting them involved early enough that they can actually have some meaningful impact to the eventual outcome. And then the other side, and Amy, our businesses are very involved in this, is sustainability, right? So, and to your point, Patti, you brought up, like, don't customize every imaginable thing about it, because if you do, it's not necessarily sustainable, or you may be tweaking something that was never meant to be tweaked that way, and it won't live over time. So I think that sustainability is a critical success factor to getting that full utilization. Like, you could do great executing, but if you don't have a framework or a vision of what 18 months from now looks like, 2 years from now, 3 years from now, and the supporting partnerships necessary to sustain that, you will not be successful.
Completely agree.
Agreed.
All right. So the last section is about looking forward. So we talked a lot about the work we do and some of the things we've seen out there with our respective customers. We'll start with you, Amy. What are some exciting yet practical technology combinations that are reasonably on the horizon that can have high impact?
Well, Patti has mentioned that I think AI is what has me most excited. And I don't say that without, of course, the caution that comes along with AI. But some of the platforms and things that I have seen that are on the market now and coming are really going to revolutionize the way that we deliver care. And to me, that's exciting because we're at a breaking point that we can't just, to to quote Patti, we just can't layer on one more thing. We need to be taking away for everything we're adding. We need to be taking away two things for everything we're adding if we want people to be at the point of care and delivering the kind of in-person care that we know that our providers got into the business for in the first place. So I think that AI is really going to be that linchpin that's going to make a huge difference. I'm also seeing a lot of exciting things around robots. There is a ton of foot traffic that clinicians put in to just get their job done. And it's repetitive and it's unnecessary, but it's just part of the gig. I was talking to a very new nurse, a nurse who's been practicing for about a year and a half, and she did her own little time study as to running for IV fluids and how many times that happens in a shift, and then multiplied that by the average rate of a nurse and came up with if we would move the IV fluids closer to the trauma bay, saving hundreds of thousands of dollars for an institution in wasted time are things that we're not even thinking about. And when robots can do those kinds of things for us, can do that running and those unnecessary tasks, it not only is going to save us money, but it's going to put the nurse or the provider, the caregiver where we want them, which is with the patient.
Great. Thank you. So Patti, we're going to go to you for the next question. So how do you see the role of health information technology evolving in acute care hospitals over the next few years? So AI obviously being one of them, robotics being another, but let's have you explore that one a little bit.
Yeah, so I agree with Amy. I think those are critical, and I have partners that I work with that are leveraging robotics, and it's really fun to watch that. And I think one of the biggest hurdles they've had is how they get on the elevator. All the other things they do really, really well. But I think the other one is the early warning systems and how we really appreciate that and embrace it. I was just in a CNO roundtable discussion, and we were spending significant amount of time around how nurses there's that, I want it to be easier and I want it to be more automated and I want things to be at my fingertips. But then there's this whole fear of how's that going to impact my rest of my world, right? And I think we have to embrace the fact that we're doing this already with early warning systems and how the adoption of those have brought 22 data elements to the table, right? And they are things that you couldn't possibly spend the time going in and out of your documentation systems. And they're able to take all 22 documentation elements, and they're able to give you a score that warns you about the patients on their way to sepsis, right? So I think it's really taking what we've been doing and really expanding upon it so that we can get the adoption. I do think, to Amy's point, our staff know better than anybody. They know the pressure points. They know what they're trying to solve. So they can actually be a part of this if we engage them in doing so. And I think that's one of the best parts. We deployed, when I was the chief nurse of a hospital system, a new bed board that helped us with falls. And it was able, based on the interfaces, it was able to share with us what their warning scores were. It was able to take all of the information and highlight them and help us look at our data and analyze our data, and were they high risk, and did the high risk patients have less falls. And I think it's that early adoption, it's that ability to show them their data, really engage them in looking at what they're seeing and how they're seeing it, that really help. It's that constant, what you're trying to accomplish and what you're trying to measure. If you're paying attention to it, they will as well. And we also did build it into their goals. And I think that's really important when we think about the adoption of this health information technology, how we leverage their goals for the year and maybe their investments or their rewards in that as well.
Great. So, Amy, I'm going to throw you a curve.
Hit me.
We covered what I wanted to cover in the next question, 11, already. So I'm going to just ask you for some of your closing thoughts, and then I'll have Patti do the same. So, what did we miss, or is something you want to add on?
So there is something I want to add on, and that is that I think that anything that's going to be successful from a technology standpoint has to impact two things. It's going to absolutely have to impact staff satisfaction. Every CNO is paying attention to how satisfied their team members are in the workplace, because they know that everybody's working on it, and they're going to lose their people to hospital B if there's something better, across the border. So I think we absolutely have to be influencing staff satisfaction. The other thing that I think that we have to be impacting is staffing. To Patti's multiple points, that we cannot make their jobs any harder than they already are. We need to be taking things away, putting them back at the point of care, and not necessarily reducing FTEs, although I would love to see that with technology. Not many technologies have been able to do that. I think AI has some real promise in that space, because we know of the shortage, but really being able to take away those unnecessary tasks and jobs of being a healthcare provider, so they can influence staffing and having higher number of hours and time spent at the bedside.
Great, thank you, Amy. And Patti, you have the last word. So we're coming to the end of our time together. So any closing thoughts for us?
I love always having the last word. If you ask my family, they'll tell you that I do that. But I think one of the things that I wanted to mention, I think, of the virtual platform. So we didn't talk much about the virtual nursing and virtual health platform, but I think that's going to be a very integral part of us transforming the way we provide care. Since the late 70s, we've been doing primary care in hospital settings. And this is giving us an opportunity, not only in the walls of a hospital, to think about the way we provide interprofessional or interrelated care, right? It is really transforming the way that we are delivering care at the bedside and outside of the home. There are so many opportunities in telehealth and telemedicine that many of us probably embarked on during COVID, but I think we've only scratched the surface here. And I do believe that this is probably our best opportunity right now to think about how we take a disruption that has taken place and how we catapult ourselves in a different way of providing care. We know we have to. We know that in the United States, cost of care is too high. Our quality is mediocre as compared to other countries, and how we can do this better and more efficiently, putting patients in their homes and providing care there, is going to be integral in helping us affect those two big outcomes.
Great. So thank you both. I appreciate having you on today. And those of you listening, I encourage you to hit the like button and subscribe so that you can get notified when we release our next episodes. Make sure to subscribe on your favorite podcasting service, and visit us on the web at www.lonestarcom.com/podcast. That's www.lonestarcom.com/podcast. Thanks so much for listening.